COVID-19 has had huge implications for our work on sexual reproductive health and rights. Young people, and especially girls, have been hard hit, with schools and college closure, incomes and families affected. Young people not only felt restricted, but we also saw a rise in early marriage, teenage pregnancy, and unsafe abortions. All in all, we have gone back almost 10 years in terms of progress made in SRHR. The impacts at the health system level and disruptions in regular provision of SRHR services has been huge. SRHR services were not listed as essential services during the first phase of the lockdown. People were left confused. Young people did not know where to access SRHR service during lockdown. Even sanitary napkins weren't available in most rural areas. Increase of gender-based violence, domestic abuse, and effects of stigma and discrimination associated with COVID-19 and their effects on SRHR, clients and healthcare providers have been significant.
The COVID-19 pandemic is part of a long foretold crisis of a development system focused on economic growth, globally fostering uncontrolled consumption, production, and waste, with ecosystem degradation and growing inequity. Instead of a renewed international solidarity, we are assisting to increase geopolitical and economic competition. The shock doctrine is applied, taking advantage of the crisis to reaffirm neoliberal hegemony and the ever-increasing influence of private interests in health and other public policies, both at national and the global level. The proposal of a pandemic treaty is in line with that logic, implying securitization of health and consolidation of global multi-stakeholder governance, further marginalizing an already heavily hijacked and disempowered World Health Organization. A globally interconnected civic action is needed to refocus on health determinants, human rights, and people-centered universalistic health systems.
It's not really news to say that COVID-19 has shown us huge inequalities, and I think it's really highlighted how much we're going to need to change how we've engaged in advocacy and research for global health policy and how we've traditionally structured global health governance in the past. We need now to have a global movement that really demands access to vaccines, that demands access to key technologies such as the internet, that demands transparency and demands change in global health governance, that reaffirms human rights, standards, and principles, and that develops new partnerships and collaborations that gets us beyond the usual suspects. And at the Digital Health and Rights Project, we're excited to think with our partners at Medicus Mundi about how best to do that in the future. Thank you.
Hi, I have news for you. COVID is not yet the global game changer in international health cooperation as much as we desperately need this. For shows, just look at the waiver issue having failed at the World Trade Organization's discussions a couple days ago. What strengthening of health systems are we talking about or are we calling for? Yes, this is a severe bottleneck, no doubt about it. But beware, it is not external funders and the roving consultants that are going to have the magic bullet to solve this. Many of us are dubious about the need and potential effectiveness of a pandemic treaty. It is posited that the existing WHO international health regulations are sufficient. If abided by. More to come on this, as several groups are working on this before the discussions come up at WHO. I have been asked, what are the long-term implications of COVID in my work? I'd rather say very few. I have been a public health and a right to health activist all my professional life. Then and today, much is left for me and for all of you to do. I hope this comes up in our discussions today. I leave it there for now. Thank you.
The pandemic has exposed the capture of global governance and narratives by profit-oriented institutions. The well-known market failures in healthcare were once again illustrated, yet nationally and globally, market-led strategies of public-private partnerships and purchasing of services continue being promoted. Going forward, the global health community must rally together to call for and support in the strengthening of public health systems and public sector health service delivery. The dominant narratives that put profit before people must be critiqued. Labor rights must be ensured for health workers and other frontline workers, the majority of whom are women. There needs to be an expansion of public employment, especially in low and middle income countries. The normative environment must shift from a market-based, commercialized provisioning of healthcare to a system based on solidarity, human rights and public accountability, one that ensures financial protection, quality and equity, and this can only be realized through strong public systems.